I will share my file and I will start, okay? In the name of God. In previous lecture, we reached to the abdominal wall, and I talk about some surface feature of the abdomen, and if you remember, I talk about the layers of the abdomen. For example, you can see in this slide the layers of the abdominal wall. For example, the external layer is skin, or the abdomen is covered by the skin, and then superficial fascia and deep fascia. The superficial fascia can be divided in two layers, if you remember, and at depth of the deep fascia in lateral wall of the abdomen you can see three layers of muscles, and then this layer is transverse fascia that lined inner surface of the transverse abdominis muscle, and the transverse fascia is a part of the endo-abdominal fascia that lined all surface in the abdomen, okay, wall of the abdomen. At depth of the transverse fascia, there is the extraperitoneal fascia or fat, and then we reach to the parietal peritoneum, this layer. The peritoneum is a balloon within the abdomen, and it has two layers: parietal layer that line the abdominal wall, inner surface of the abdominal wall, and visceral layer that cover the organs within the abdomen. Okay, so we reviewed the muscle, we reviewed the skin and the fascia in the abdomen and reached to the muscle, if you remember, and I explained some of these muscles. For example, the abdomen consists of three broad thin sheets that are aponeurotic in front, okay? It changed to the aponeurosis in front of the abdomen. From exterior to interior, there are three muscles: external oblique, lateral wall of the abdomen, external oblique, internal oblique, and transverse abdominis. And in front of the vertical muscle is called the rectus abdominis. They lie on either side of the midline anteriorly. Okay, in this, the rectus abdominis muscle in each side of the midline, and muscle external oblique, internal oblique, and transverse abdominis in lateral wall of the abdomen. So we can divide the muscle of the abdomen in two groups: anterolateral and posterior. In anterolateral group, there are obliquus externus or external oblique, obliquus internus or internal oblique, and transverse abdominis, and finally the rectus abdominis muscle. Like this, you can see the external oblique, internal oblique, and you can see the rectus abdominis muscle. And if we remove the internal transverse abdominis muscle, this muscle, okay? And the other group is the posterior group. In posterior wall of the abdomen, there are some muscle like the quadratus lumborum, this muscle, quadratus lumborum, and psoas major muscle, and psoas minor, the psoas minor muscle, and iliacus. In each side, in iliac fossa there is about the external oblique and internal oblique in previous lecture, but now I will review this muscle and I will explain the other muscle in abdominal wall. Okay, at first the external oblique, if you remember this muscle, external origins from the lower 8 ribs, and the muscle fibers of external oblique runs downward, anteriorly and medially. Okay, downward, anteriorly and medially. Okay, and in midclavicular line the muscle fibers ended and it's changed to a broad aponeurosis that passes in front of and reach in midline in linea alba. Okay, this insertion of the external oblique is from the xiphoid process. That means it's attached to xiphoid process. You can see in insertion of this muscle, linea alba and pubic crest, pubic tubercle, and some muscle fiber of the external oblique inserted. If you remember, there is the iliac crest in each side, and it's innervated from the lower 6 thoracic nerve and the L1 by two nerves called iliohypogastric and ilioinguinal nerve, origin from the L1. Okay, this is the external oblique, and I talked about the action or function of this muscle. For example, the external oblique can support abdominal content, can compress abdominal content, and assist in flexion of the trunk and rotation of the trunk by the opposite internal oblique. Okay, and it can forces it can assist in forced expiration, okay, and the other function like defecation, micturition, and vomiting, for example. Okay, this is the function of the external oblique. Between the anterior superior iliac spine of the iliac crest, lower border of the aponeurosis of external oblique, folded backward on itself and forms the inguinal ligament. So the inguinal ligament is a part of the aponeurosis of the anterior superior iliac spine to the pubic tubercle. Okay, it's the external oblique aponeurosis lies immediately above and medial to the pubic tubercle, known as the superficial inguinal ring. Attention please. In anterior wall of the abdomen, above the inguinal ligament, for passage of the spermatic cord in man, and round ligament in female or women. Okay, so this canal, the superficial ring, is the defecation oblique aponeurosis, like this. Attention please. That means the aponeurosis of the external oblique bifurcated here, and the lateral, it's formed to cross. Lateral cross attached to pubic tubercle, and medial cross attached to pubic crest here near the midline. Okay, and forms one opening, one ring It's called the superficial inguinal ring. And you can see the inguinal ligament extended from the anterior superior iliac spine to the pubic tubercle. Pubic tubercle of the pubis. Okay. Some part of the inguinal ligament bone in this picture. Okay, ligamentum reflexum. Ligamentum reflexum. The ligamentum reflexum posteriorly supported about this in previous lecture, and now I review. Okay, inguinal ring, some membranous fibers you can see here extended covered the spermatic cord. This and it's called the external spermatic fascia. External, okay? The spermatic cord covered by three layers of fascia. External spermatic, internal. We'll explain about all of these layers. The other internal oblique, this muscle. The internal oblique muscle origins from the lumbar fascia, from back to the abdomen, okay? Lumbar fascia. Lumbar fascia is origin from the lumbar vertebra, and muscle fibers origin from the iliac crest, and two-thirds, lateral two-thirds of inguinal ligament. Lateral two-thirds of inguinal ligament is a site for origins of some muscle fibers of internal oblique. And you can see the muscle fiber of internal oblique runs upward and medially and anteriorly, and then it's changed to the aponeurosis. The aponeurosis of the internal oblique bifurcated and covered the rectus abdominis muscle. The anterior sheath passes in front of the rectus, and posterior sheath it can passes back to the rectus abdominis and finally reach to the linea alba, the aponeurosis of internal oblique. So finally it's attached in lower three ribs and costal margin. Lower three ribs and costal margins, and the fluid process linea alba to the symphysis pubis. Okay, some muscle fiber of internal oblique can passes in front of the inguinal canal, and then it's turned upward and backward of the inguinal canal, and finally this Hello again. We disconnected for some minutes. Can you hear me? Dear student. Okay. We can continue, okay? I talk about the muscle of the abdomen. I talk about the external oblique and internal oblique, okay? Attention please, some muscle fibers extended downward around the spermatic cord and forms the other fascia spermatic cord. It's called cremasteric fascia. These muscle fibers also called the cremaster muscle, okay? And this fascia around cremasteric fascia, okay? The other muscle in lateral wall of the abdomen is called transverse abdominis muscle. Transverse abdominis or transversus muscle, okay? If we remove the external oblique and the internal oblique, at depths of the internal oblique, we can see the transversus abdominis. The muscle fibers runs horizontally, or it's run anteriorly and medially. You can see here. Transverse abdominis origins 6 costal cartilage, lower 6 costal cartilage, okay? That means from the lower 6 ribs and its cartilage, and origins from the lumbar fascia. In each side of the lumbar vertebra there is the lumbar fascia, and some fiber of transverse the iliac crest, and also from the lateral third of the inguinal ligament, okay? All of this area is a site for origins from transverse abdominis muscle. The muscle fibers ended in midclavicular line and it's changed to aponeurosis, to broad aponeurosis, okay? This broad aponeurosis usually passes back to the rectus abdominis and reach to the linea alba. So the insertion of the transverse abdominis muscle is from the xiphoid process and symphysis of pubis, okay? The innervation of the transverse abdominis is like the other muscle in each side of the abdomen, from the lower 6 thoracic nerve and ilioinguinal nerve from L1. And what is the function of transverse abdominis? It can compress abdominal content. Compresses of abdominal content, okay? This is the function of the transverse abdominis muscle. At depths of transverse abdominis muscle, there is the transverse fascia, a part of the endoabdominal fascia, okay? The transverse fascia continues within the inguinal canal and cover the spermatic cord and forms the third layer. You can see here, if we remove we can see the transverse fascia, and transverse fascia enters to inguinal canal and third layer of fascia around the spermatocord is called the internal spermatic fascia. Internal spermatic fascia is a continuation of the transverse fascia, not the transverse muscle. Okay? Again, attention please. The internal spermatic fascia is the continuation of transverse fascia. It's important. And we can see the inguinal canal here, the cord. Spermatic cord is the ductus deferens, and the vessels connect the testis to the organs within the pelvis. The other muscle in this group in abdominis, rectus abdominis muscle. Attention please. This muscle, it's lie in each side of the midline. We can see the rectus abdominis. Its origins from the pubic crest inferiorly. In fibers to the 5th, 6th, and 7th costal is innervated by the thoracic nerve, lower 6th thoracic nerve, and also it can divided in some segments by the intersection tendon. Usually we can see the 3 intersection tendons. Of these tendons is lie at the level of the umbilicus, and the superior intersection tendon is lie parallel to the costal margin. And what is the function of the rectus abdominis muscle? Attention please. The rectus abdominis muscle can compress its abdominal content, and it's very important of the trunk, flexion of the trunk, okay? And it can flex its vertebral column, trunk and vertebral column, okay? And is accessory muscle of expiration. Is accessory muscle of the expiration, okay, of deep expiration. So this muscle is a vertical muscle, and we can call the rectus abdominis. Okay, it's important muscle in abdominal wall. Look at here. Near the abdominis, we can see some muscle fibers that continues from the pubic bone to muscle fibers, or this muscle is called the pyramidalis muscle. In some person, the pyramidalis muscle is absent, okay, or in one side is absent, for example. Not important for the abdominal wall, but if it's present, the pyramidalis muscle origins from the anterior surface of pubis. surface of pubis bone, and the muscle fibers runs upward and medially and reach to linea alba. The insertion of pyramidalis muscle is linea alba, and it's innervated by a branch of the 12th thoracic, and it can tenses the linea alba. Okay. All of these are the muscle around the anterior and lateral wall of the abdomen. Okay. There is the other terms. Sheet. What is the rectus sheet? That means the sheet that covered the rectus abdominis. Okay. We must describe this sheet. Attention, please. For it is considered at three levels. First, above the costal margin, has anterior wall, and the anterior wall is formed by the aponeuroses of external oblique, and the wall is formed by thoracic wall. Okay, so the rectus sheet above the costal margin only has the anterior wall, then formed by the aponeuroses of external oblique. That is the fifth cartilage and intercostal space, the posterior wall of the rectus above the costal margin. Okay, between the costal margin and anterior superior iliac spine. Attention, please. Between the costal margin in above and at the level of anterior area. The aponeuroses of internal oblique, aponeuroses of splits into layer. Okay, and is the rectus muscle. The external oblique aponeuroses is directional, and the transverse abdominis muscle aponeuroses is directed behind the muscle. Attention, please. So, at the level and or between the costal margin and the anterior superior iliac spine, the external oblique aponeuroses in front of the rectus, the internal oblique aponeuroses splits into layer, and the transverse abdominis aponeuroses passes back to the abdominis. Look at here. In this picture, you can see a transverse section. Transverse section of abdominal. The exterior layer is skin and superficial fascia, deep fascia, muscles, and in lateral wall you can see the external oblique, internal oblique, and transverse abdominis and their aponeuroses. Okay, and then extra peritoneal fat or fascia and parietal peritoneum. Okay, so you can see all of this layer of abdominal wall. But this is a section of rectus side of the linea alba, in each side of the linea alba. Okay, and look at here. The aponeuroses of the external oblique passes in front of the rectus reach to linea alba. The aponeurosis of internal oblique split into passes in front and posterior layer passes back to the rectus abdominis muscle and finally reach to the linea alba. And aponeurosis of rectus abdominis muscle passes back abdominis muscle and reach to the linea alba. Okay, linea alba is a fibrous bond extend from substernum to the. Okay, this pattern is shown at the level of anterior superior iliac spine. Okay, and between the level of anterior superior iliac spine and the pubis, okay, or the part of the sheath, rectus sheath, okay, lower than the level of anterior superior iliac spine. The aponeurosis of three muscles. Aponeurosis of form the anterior wall, and the posterior wall of rectus sheath is absent. Posterior wall of the rectus sheath is absent. Posterior at this level. Posteriorly, the rectus muscle covered only by transverse fascia. Transverse fascia, okay? The rectus muscle lies in contact with the fascia transversalis or transversalis fascia. Look at this picture. This picture is a transverse section under the anterior superior iliac spine, okay? And you can notice of three muscle passes in front of the rectus abdominis and reach to the linea alba. Posteriorly, the rectus abdominis muscle covered only by transverse fascia. Look at here. This is a section, this is a coronal section of the abdomen, and remove the anterior wall, and we can see the anterior wall of the abdomen from the posterior. Okay, from the posterior view, this is the umbilicus. Choose the arcuate line. Okay, the arcuate line limitation at the level of the anterior superior iliac spine is a limitation between the
تصویرتون باشه.
باشه. بگید شیدی بیارم میزنم.
باشه.
Okay. We reach to the nerve of the abdominal lower thoracic nerves and the subcostal. Okay. Attention please. The nerve of the anterior abdominal wall in muscles and parietal peritoneum. Parietal peritoneum is innervated nerves that supply the anterior abdominal wall. Okay. And this nerve are drones of lower 6 thoracic and the first lumbar nerve. And attention please, the inflammation of the parietal peritoneum. Parietal peritoneum is a layer of anterior and lateral abdominal wall. Okay, the inflammation of the parietal peritoneum causes the pain in. Okay, and the skin becomes sensitive at this level. Okay, and also a reflex increasing in tone of the abdominal muscle in the same area. For example, in this you can see the dermatome in abdominal wall. What is the dermatome? A piece of the skin, that innervated by the same nerve, spinal nerve. It's called the dermatome. Okay, dermatome. And the dermatome of the abdominal wall, it begins inferior to the xiphoid process and is innervated by T7 to the L1. You can see the lower 6 thoracic nerve from T7 to T12 and branches of L1. And also you can see the skin around the umbilicus, for example, is innervated by T10. Okay, and also you can see the schematic shape in this picture. The end of the T7 to T12 nerves and the branches from the L1. For example, this is the iliaco-hypogastric, and these nerves that exit from the superficial inguinal ring, it's called ilioinguinal nerve. It enters to the spermatic cord, ilioinguinal nerve. Okay, and laterally, the skin of the flank between the costal margin and iliac crest, innervated by T10 and T11. T10 and T11. Look at here. This is the transverse section in the abdomen. Okay, and you can see 3 layers of muscle: external oblique, internal oblique, and transverse abdominis. And here you can see the spinal nerve. Each spinal nerve exit from the intervertebral foramen, and it has a posterior ramus for the skin and muscle of the back and the anterior ramus. Anterior ramus passes in lateral wall of the abdomen, passes anteriorly and inferiorly, and it lies between the transverse abdominis and internal oblique. Okay, and passes anteriorly. And in this route, the branches of the artery, some artery, it's lie near the nerves. In lateral side of the abdomen or body, this anterior ramus of spinal cord has lateral cutaneous nerve for lateral skin, okay, that pierces the internal and external oblique muscles and reach to the skin, okay, and innervated the skin in lateral side of the body or abdomen. And the other branch that continues this route is called the anterior branch, okay. These nerves in abdominal wall, okay, posteriorly the rectus sheath. This is the rectus sheath, okay. Posteriorly it's enters to the rectus sheath and it can innervate the rectus abdominis and also pierces the sheath anteriorly and reach to the skin in anterior wall of the abdomen. So the final branches, okay, that reach to the skin is called anterior cutaneous nerve. Anterior cutaneous nerve, okay. This is the pattern for this nerve. Here you can see the anterior cutaneous nerve at the surface of the rectus muscle, and all of these are lateral cutaneous of the lower 6 nerves. And finally the L1 branches, ilohypogastric and iloinguinal in inguinal canal, and it's close to the spermatic cord. It's called ilo. Okay, so this nerve can innervate the abdominal wall. The other subject is blood supply. Okay, the skin near the midline, is supplied by branches of superior epigastric artery. This artery is a branch of the internal thoracic artery. I will explain it, okay? And the inferior epigastric artery. Epigastric artery is a branches of external iliac artery. So near the midline, skin and the muscles, near the midline of anterior abdominal wall, supplied by some arteries like the superior epigastric and arteries. Skin of the flank is supplied by branches from the intercostal, lumbar and deep circumflex arteries. I will explain all of this, okay? Look at here. This artery is superior epigastric artery. Enters to the rectus sheath, okay, and supplies the rectus abdominis and the skin in midline, okay. The superior internal thoracic artery, it arises from the subclavian artery in the neck, okay, in the neck. This is the subclavian artery. In each side you can see the subclavian artery. It rises from the subclavian artery and runs downward behind the costal cartilage. And when it reaches, it can be divided in 2 branches. Musculopharynx, this is this branch, musculopharynx artery, and the other artery is the other branch is artery. Finally, the superior epigastric artery joined to the inferior epigastric artery around the umbilicus. Inferior epigastric artery. Inferior epigastric artery is a branch of external iliac artery. You can see this arteries, okay? There is the other branch, it's called superficial epigastric artery. When the external iliac artery passes downward from the iliac ligament, it's inter and it's called femoral artery. Femoral artery has some branches like superficial epigastric supply the skin of the lower part of the abdomen until the umbilicus, and it has the other branch, it's called superficial circumflex iliac artery. Superficial circumflex iliac artery. It runs parallel to the and supply the skin of this area, okay? And here, look at here, the abdominal aorta, it can be divided in two branches called common iliac artery in each side, and the common iliac artery in front of the sacroiliac joint, it can be divided in two branches, internal iliac and external iliac. External iliac runs downward and passes behind the inguinal ligament and enters to the thigh and continues as the femoral artery. Attention please. Attention please. Before the external iliac artery passes inguinal ligament, it has some branches like the inferior epigastric artery, and deep circumflex iliac artery that supply muscle and the other organ around the iliac crest. So this is the deep circumflex iliac artery. After this artery passes and enters to the thigh, it's called femoral artery, and the superficial epigastric artery, circumflex iliac artery are the branches from the femoral artery, okay? And you can see here some subcostal artery, for example, and some lumbar arteries from the abdominal aorta can supply the posterior and lateral wall of the abdomen. In this picture, you can see again superior epigastric, inferior epigastric, deep circumflex iliac artery, and some arteries from the lateral wall, like the subcostal and lumbar arteries, for example. Here you can see this anastomosis with lower intercostal and subcostal and lumbar arteries, wall of the abdomen, and here you can see superior epigastric artery, inferior epigastric artery, deep circumflex and superficial epigastric and superficial circumflex iliac artery from the femoral artery. You can see again all of these branches supply the abdominal wall, okay? Okay, it's enough for this lecture. You can rest for 5 minutes. After 5 minutes, I will back and I will continue this lecture, okay? I will back. Attention, please. Okay, hello again. Are you ready? Okay, we can continue the second lecture for today. Attention, please. Look at here. I talk about the blood supply of abdominal wall. Okay, I talk about the superior epigastric artery, that is a branches from the internal thoracic artery, and inferior epigastric artery is a branches from the external iliac. The other artery is deep circumflex iliac artery from the external iliac. And also from the femoral artery, there are some branches like the superficial epigastric artery and superficial superficial circumflex iliac artery. And you can see some posterior intercostal and lumbar branches that supply the lateral wall of the abdomen. Okay, after we learn the arteries, we must drainage of abdominal wall. Attention please, the venous blood is collected into that radiated around the umbilicus. Okay, the network is drained above into the axilla. It drains above to the axillary vein via the lateral thoracic vein, epigastric vein. Okay, below into the femoral vein, below to the umbilicus. It's drained to the femoral vein, epigastric, and the great saphenous vein. Okay, attention please, is about the superficial vein around the umbilicus. Upward is drained to the axillary vein, and downward is femoral vein or great saphenous vein. Few small veins, the paraumbilical vein, important portal system, venous anastomosis. The anastomosis, the vein, superficial vein, and deep vein within the abdomen. Okay, it has a clinical importance. Okay, look at here. You can see in this picture the epigastric veins is connected to the axillary vein by this thoracoepigastric vein, and here under the umbilicus is connect and drain vein or great saphenous vein by superficial epigastric vein. Deep veins are the same name of the arteries. For example, your epigastric vein, inferior epigastric vein, and deep circumflex iliac vein. For example, this vein can drain the venous blood. This term, caput medusa, the superficial veins around vein. Portal vein is lie within the abdomen, may become grossly distal portal veins obstruction. The portal vein becomes obstructed by some material, for example, the venous blood, okay, becomes larger around the, and this forms a picture called caput medusa, like this picture. Clinically, it's called caput medusa pattern. Okay, and here you can see the venous collection of the superficial vein around the umbilicus. Superficial vein, okay, drains upward to the axillary vein or downward to the femoral vein. And here you can see again this superficial vein and its drainage to this. Finally, lymph drainage of the abdominal wall, anterior abdominal wall, lymph drainage, okay? The lymph drainage of the skin, anterior abdominal wall, above at the level of umbilicus, above to the umbilicus, okay, to axillary node, to anterior axillary node. It's called pectoral group because it's lie near the pectoralis muscle group of nodes. And below to the umbilicus, the lymph drains to under the inguinal ligament. It's called superficial inguinal nodes. Superficial inguinal nodes, okay? And swelling in the groin is maybe due to enlarged superficial inguinal nodes. And you can see in this picture the drainage of the lymph, okay? This is the umbilicus, and above to the umbilicus the lymph drains to the axillary lymph node, pectoral group, and below to the umbilicus the lymph drains within the superficial inguinal nodes under the inguinal ligament. You can see here, okay? Okay, the feature of the anterior and lateral abdominal wall is finished, and we can see some feature of the anterior abdominal wall from posterior view, and we will review the inguinal canal. Okay, if we remove the anterior abdominal wall, okay, and if we see the anterior abdominal wall from the posterior view, from the back, you can see this picture, okay? In one half of this picture, the parietal peritoneum is present, and in the other side is absent. This blue layer in this picture, blue layer, okay? The peritoneum lined all surface in abdomen, okay? But here it's cut, okay? If we see posterior view of the anterior abdominal wall under the umbilicus, we can see some fold. We can see some fold. Okay, folds and fossa of abdominal wall. Posterior view of the anterior abdominal wall. Okay, this fold, there are 5 fold. One of these is median, 2 medial, and attention please, median fold, medial fold, and lateral fold. Okay, what is the median fold? All of these folds called umbilical fold. Attention please, umbilical fold. Median umbilical is formed when the peritoneum covered the remnant of the. What is the urachus? In embryonic period, the urachus connect the urinary bladder to the umbilicus. Attention please, this space is the pelvis and this is the urinary bladder, and the apex of urine connect to the umbilicus by the remnant of urachus. It's called ligament. Median umbilical ligament connect the apex of urinary bladder to the umbilicus. When the peritoneum covered the medial umbilical ligament, it's formed the median umbilical fold. Okay, you can see the medial umbilical fold. The medial umbilical fold forms by coverage of the parietal of the umbilical arteries. This is the remnant of umbilical arteries. Okay, the peritoneum covered the umbilical arteries, remnant of umbilical arteries, medial umbilical fold, and finally the lateral umbilical fold contains the inferior epigastric vessels, or branches from the external iliac. You can see what is the inferior epigastric. Okay, I talk about this. When the peritoneum covered this vessel, is formed the lateral umbilical fold. All of this fold, okay, finally ascends toward the umbilicus. And this, between these folds, there are some fossa. At the medial umbilical folds, this fossa is called supravesical. Vesical, that means the urinary bladder. This fossa between medial and lateral umbilical fold is called medial inguinal fossa, and this fossa that lies lateral to the lateral umbilical fold is called the lateral inguinal fossa. Lateral. Attention please. The deep inguinal ring for inguinal colons lie in lateral inguinal fossa, and you can see here the ductus deferens, that passage of the sperms. It passes and exits here from the deep inguinal ring. Is the deep inguinal ring, and the ductus deferens, it passes from this canal and reach to seminal vesicle and prostate gland. Okay, in this picture you can see again, for example, in this slide, in the right side you can see the peritoneum, and in left side the peritoneum is removed, and you can see this is the median umbilical fold, medial umbilical fold, and lateral umbilical fold. This is the supravesical fossa, medial inguinal fossa, and lateral inguinal fossa. And the deep inguinal ring is lie in lateral inguinal fossa. You can see the and this is the women pelvis, and this is the uterus, and the round ligament in women passes from the inguinal ligament and reach to the skin of and so this is the round ligament of uterus. What is the inguinal region? Inguinal region, okay? You know that this is the inguinal ligament. There is the inguinal ligament, okay? The boundaries of the inguinal region: inferiorly inguinal ligament, okay, and also the lateral margin of rectus abdominis muscle. This is the rectus abdominis muscle. The lateral margin of rectus abdominis muscle, and a horizontal line we can draw between lateral margin of rectus abdominis and anterior superior iliac triangle. This triangle you can see here. This triangle is called the inguinal region. Okay, inguinal. This is the inguinal ligament. Inguinal ligament that extend from anterior superior iliac spine to the pubic tubercle. The inguinal ligament is a part of the oblique aponeurosis, external oblique aponeurosis, okay? And you know that this is the lacunar ligament that bounded medially the femoral ring, okay? And it continues as pectinal ligament. You know that this is the pectinal ligament. Inguinal ligament, lacunar ligament, and pectinal ligament, okay? And if you remember, this yellow band, this band is ligamentum reflexum, or reflected part of inguinal ligament, okay? What is the inguinal canal? The abdominal wall, the inferior part of abdominal wall above the inguinal ligament, okay? The abdominal wall has a canal, a potential canal for passage of a spermatocord in men and round ligament in women, okay? This weak part of the abdominal wall is called inguinal canal. It's called the inguinal canal, okay? You can see here. This canal is lie above the medial half of the inguinal ligament. Okay, what is the position of inguinal canal? The inguinal canal is oblique passage. Yes, it's oblique passage. The length of inguinal canal is 4 centimeter. 4 centimeter, and it's located 1.5 centimeter above the medial half of the inguinal ligament. Okay, it has some wall. Anterior, superior, posterior, and inferior wall. Okay, and it has two opening or two ring, superficial and deep ring. Superficial ring and deep ring. This is a oblique canal or oblique passage for the spermatic cord and the round ligament. You can see here. This is the external oblique aponeurosis. External oblique aponeurosis. If we cut this aponeurosis, we can see the muscle fiber of the internal oblique. Okay, and we can see that enters around the spermatic cord. Boundaries of the inguinal canal. The anterior wall. At first, the anterior wall of this canal. Anterior wall, inguinal canal, anterior wall, is formed by aponeurosis of external oblique muscle. But laterally, the anterior wall of the inguinal canal supported by some muscle fibers of internal. The anterior wall of the inguinal canal is formed by aponeurosis of external oblique, and the internal oblique muscle is formed by internal oblique muscle. Look at here. Is posterior wall. Attention please. The posterior wall of the inguinal canal is formed by the transverse fascia. But medially the posterior wall inguinal canal is reinforced. It's reinforced by conjoint tendon. What is the conjoint tendon? Conjoint tendon is formed by joining of muscle fiber of internal oblique and transverse abdominis, that finally it passes behind the superficial inguinal ring and it's connect breast. Okay, so the posterior wall is formed by transverse fascia and inguinal flux medially. Inguinal flux, that means the conjoint tendon that forms by internal oblique and transverse abdomen. The roof of the inguinal canal. The muscle fiber of internal oblique curves from superior and posterior of the canal. So arched lower fiber of internal and transverse abdominis forms the roof of the canal, and finally the of the inguinal canal is formed by inguinal ligament. Inguinal ligament forms the floor of the inguinal canal. The inguinal canal can open and can close by contraction of the muscle. Look at this picture. If the muscle of abdominal wall contracted, the inguinal canal becomes closed by contraction of the muscle fibers, okay, of abdominal wall. The inguinal canal becomes closed. You can see the inguinal canal has two openings or two rings. Superficial inguinal ring is defecation of the aponeurosis of external oblique. Inguinal ring. Deep inguinal ring is defect in transverse fascia. 1.5 centimeter above midpoint of inguinal ligament. This is the inguinal ligament. This is the inguinal ligament, and this is the midpoint of inguinal ligament. Above of midpoint of inguinal ligament, we can see the deep inguinal ring is a defection of transverse fascia that forms the deep inguinal ring, and some structures like the ductus deferens ligament of uterus in women. It passes from this ring. You can see here in men and women. In men, the spermatic cord passes from the inguinal canal, and the round ligament of the uterus, it passes within the inguinal canal and reaches labium majus. Structures passes through the inguinal canal. A spermatic cord and ileoinguinal nerve. Ileoinguinal nerve, if you remember, is the branches of L1, first lumbar spinal nerve. In male and round ligament of uterus and ileoinguinal nerve in female or woman. Okay, this is the content of the inguinal ligament. Inguinal triangle. There is the other term, it's called the inguinal triangle or Hasselbalch triangle. Look at here. The boundary of this triangle, inguinal ligament inferiorly, lateral border of rectus abdominis here, lateral border of, and inferior epigastric vessel. That means this triangle is of the canal, and some hernia can cause in this triangle, okay, can forms in this. You can see in this picture. Okay, if you remember, I talked about some spermatic fascia, external, that continues from the margin of superficial inguinal ring from the aponeurosis of external oblique margin, the spermatic cord, and here you can see the external spermatic cord from the superficial inguinal ring, and this layer is the aponeurosis of external oblique. Look at here. This picture shows the canal layer by layer, okay? And this is the external oblique aponeurosis. Look at here. The second layer, internal oblique. Some muscle fiber of internal oblique enters to the canal and covers the spermatic cord. That's called the cremasteric fascia. And you can see oblique muscle forms the roof, some part of anterior wall, roof, and of the inguinal canal. And this is the transverse abdominis muscle. Transverse abdominis muscle, only posterior wall, and some muscle fibers are in roof of the inguinal canal. Muscle, you can see the transverse fascia. Transverse fascia, a continuation of transverse fascia that covered the testicular vessels. It enters to the inguinal canal and reaches the testis. For example, it's called internal fascia. This funnel shape here is formed the deep inguinal ring. Deep, okay? And this fascia, transverse fascia, form the posterior wall of inguinal canal. Posterior wall of the inguinal canal, okay? And look at here, this nerve that enters to the inguinal canal from the roof, from above, okay? From the roof of this canal. It enters to the inguinal, it's called ileoinguinal nerve, and enters to the spermatic cord of the scrotum, okay? And look at here, this is the ileoinguinal nerve that reaches to the skin of the scrotum. Again, the cremasteric fascia, and here you can see the internal spermatic fascia, okay? The other term about the descent of the testis. What does this mean? In the men, okay, the spermatogenesis that form the formation of the sperm, it's occur in the testis, and the testis lies within the scrotum, skin, outside of the body, outside of the trunk, okay? But in embryonic period, the testis is formed and develop within the abdominal cavity. It forms and develop in gonadal ridge around the lumbar area in the embryonic period, okay? And then the testis descends, okay? Descends inferiorly, and it passes within the inguinal canal of abdominal wall, and finally enters to the scrotum. This process is called descent of testis. Okay, 7-week embryo showing the testis before it descends from the dorsal abdominal wall. Okay, it's formed at first in dorsal abdominal wall. The ovary in women also descends inferiorly, but finally it's lie in lateral wall of the pelvis. In female, the ovary finally lie in lateral wall of the pelvis, but in the man, the testis must exit from the body, because the spermatogenesis, the formation of the sperms, occurs in lower temperature of the body temperature. Okay, so it's held in a scrotum. In this picture you can see the passage of the testis within the inguinal canal and its entrance to the scrotum. This picture shows the fetus at 28 week. At 28 week, the testis through the inguinal canal. Okay, the testis passing during the inguinal or through the inguinal canal. Look at here. For descent, attention please, all of this process are in embryology book. Okay, for example, in Longman book you can review all of these process and you will learn all of this process in embryology, in development of the body, for example, in the other semester. Okay, but look at in this picture. For passage of the testis, at first a part of the peritoneum passes from the abdominal wall and enters to the scrotum and forms a sac. This process of peritoneum is called vaginal process, and then the testis can pass through the abdominal wall from the inguinal canal and it can enter to the scrotum like this. Finally, the connection between the vaginal process and peritoneum is closed. Only a small space remains around the testis in the scrotum. Okay, and this duct is ductus deferens that connect the testis to the seminal vesicle and prostate gland. Okay, so when the testis it passes through the inguinal canal, this duct connect the testis to the pelvic space, to the seminal vesicle and prostate gland. Finally, okay, this ductus deferens and the vessels around it that reach to the testis forms the spermatic cord. In male or in man. Okay, this picture shows the newborn. Sometimes one or two of these testes cannot descend and cannot passes within the inguinal canal and cannot enter to the scrotum, and this testis may be degenerated within the pelvic cavity, for example, and it's not good. Okay, look at this picture again. This picture shows the abdominal wall, the layers, the three layers of muscle of abdominal wall, and this is the transverse fascia. Look at here. When the testis descend and pass through the abdominal wall here, it can it not pierces these muscles, but it's push the abdominal wall. It pushes the abdominal wall, and the some layer of abdominal wall surrounded the spermatic cord and forms the spermatic fascia. For example, like this picture. For example, when the testis passes from the transverse fascia, it forms the internal spermatic. This is the transverse fascia. Forms the internal spermatic, and when it passes from the cell, it forms the cremasteric fascia, and when it passes through the oblique muscle, it forms the external spermatic fascia. This layer surrounded the testis, scrotum, and you can see here the spermatic cord contains the ductus deferens, this duct, and the artery and vein around the ductus deferens. Okay, this is the ductus deferens, and this is the nerve. This is the genital branch of genitofemoral nerve. I will explain about this nerve in the next lecture. So you can see the inguinal canal at this level. This is the deep inguinal ring, and here you can see the superficial inguinal ring, deep and superficial inguinal ring, anterior wall of the inguinal canal, superior, inferior, and posterior wall. Okay. There are two types of hernia. Okay, what is the hernia? The passage of some coil of a small intestine within the inguinal canal and enters of this small intestine to the scrotum, especially in men. Okay, this phenomenon is called the hernia. Type of hernia: indirect inguinal hernia and direct inguinal hernia. Indirect and direct. What is the difference between two hernia? Look at here. Inguinal ring and deep inguinal ring. Okay, and if the pressure of content within the abdomen, okay, rises, some coil of the small intestine can push the abdominal wall, and the weakest part of the abdominal wall in Hasselbalch triangle, if you remember. In Hasselbalch triangle is a weak part of abdominal wall. The coil of the small intestine can push here and can enter here, and it can enter directly. This type of hernia is called direct inguinal hernia. Okay, and the other type of hernia, if the coil of a small intestine enters to deep inguinal ring like this picture. If the coil of a small intestine enters to the deep inguinal ring and enters to inguinal canals and finally reach to the scrotum, it's called the indirect hernia. Okay, it's called the indirect inguinal hernia. So the weakest part of the abdominal wall is around the inguinal canal, and by increasing the pressure of the abdominal content, okay, the small intestine can push the abdominal wall and can enter to the scrotum, especially it's seen in the man, okay, and it's called hernia. And there are two different type of hernia, direct and indirect. Okay, this is the difference between the direct and indirect hernia. Okay, this lecture is finished, and me anything about this lecture. If you have any question, you can ask me. Dear student, if you don't have any question, okay, have a good bye, and okay, have a good time and goodbye.